Guys, I'm Dorothy Yip, a practicing PA in Northern California, specializing in ENT, ear, nose, throat, and internal medicine. I made this video for the purpose of going over some symptoms of COVID-19, how it's different from the seasonal flu, and also the general management plans as of today, March 19, 2020, of what to do if you yourself or you suspect someone you know uh, is indeed having COVID-19. The most important thing to remember is COVID-19 symptoms really fall into a wide spectrum, in that you can have people that have contracted the virus and or get infected by the virus and have completely no symptom, what we call asymptomatic, or you will have patients that contract the same virus and would end up needing being hospitalized, being on ventilator, and obviously, as all of us know, could end up dying from this virus. So I'm gonna focus in terms of the symptoms. Are there symptoms of COVID-19 where is a common classic picture of patients that have symptoms of COVID-19? And that would include things such as typically fever over 100 degrees Fahrenheit, a cough that are typically dry versus being very mucousy and phlegmy, and you can have body aches, which is there's some similarity to the seasonal flu. You can have runny nose and some sore throat, though typically those symptoms are a little bit not as common in COVID-19 comparing to, say, a common cold or allergy symptoms. Now, the most important symptom that you have to look out for with COVID-19 is actually shortness of breath. And that particular symptom is important because one is separated quite a bit from all the other respiratory symptoms from seasonal flu or cold or allergy type thing, shortness of breath. And the second reason that is important is because that is the time when you have COVID-19, and if you have shortness of breath, you really are the patient that should get tested, and also obviously check with your provider and the urgent care, things like that. But most situation, you might end up needing some type of level of care from urgent care or even the hospital. So if the typical progression of COVID-19 cases that end up showing up at the hospital commonly would start out with a dry cough for the first couple of days, have some degree of fever over 100 degrees Fahrenheit. And typically by the fourth and fifth day is usually when people start having shortness of breath. And by shortness of breath, what we mean is you have trouble taking a full breath. You feel like your lungs just cannot expand all the way. And when you try to talk a full sentence, you keep having to pause, or just the general idea of like you feel like you're in a vacuum room, you just cannot get that breath in. And if that is the case, please do call your local urgent care, your primary care, because they will be able to give you more information on what to do at that point. And with that said, actually, just note that most of the urgent care, at least in Northern California at this point, does not take walk-in visits. So make sure you call them ahead of time. And the reason of us doing that is so that we will be prepared for a possible COVID-19 case showing up, and we'll triage you to a separate area so you would not be spreading the virus to staff, providers, and other patients. So now I mentioned about the severe cases, but like I said, the symptoms can really fall in a pretty wide spectrum. Now, if you feel like you have COVID-19 because you do have some degree of fever, you're achy, you have a dry cough, and usually you also have the risk factors of getting in contact with it, and that would include recent travel to hot spots like Italy, China, and South Korea, that type of area, or being on a cruise. And also risk factor would be if you have come in contact with someone that had confirmed test positive COVID-19 or highly suspicious of COVID-19 or waiting on test result of COVID-19, then yes, in those cases, obviously your likelihood of actually experiencing COVID-19 symptoms and having been infected by it would be much higher than someone else that just have fever and a cough. So bear those risk factors in mind. And in addition to that, the main thing I want to really point out is even if you truly think you're COVID-19, but you're not suffering a severe degree of symptoms of it, if you don't have shortness of breath, or you have a little bit shortness of breath, but with your albuterol inhaler and things like that, you're really doing fine. You have 100-degree fever, but it's not spiking up to 104, and the Tylenol is not working. In those cases, you really, really do not need to be at an urgent care or hospital. The reason being, actually, there are very, very strict criteria of who can even get tested for COVID-19. So just because you have a cough does not fit that criteria. And with that said, even in the rare case that you did have a test done and you were tested positive, if your symptoms are really mild and really do not at the point that you receive care do not appear that you will end up needing supplemental oxygen, ventilation, that type of thing, what we're going to do is actually send you home to self-isolate for 14 days and have you take over-counter medicines such as Tylenol, Mucinex, Robitussin, doing saline rinses for your nose, that sort of things. And in terms of over-counter medication, as of today, there's some data showing that the class of medication called NSAIDs, which include ibuprofen, Celebrex, Aleve, Motrin, Advil. The NSAID class of medication, which normally people take for a little bit of pains and aches and fever, apparently there's data showing that taking that class of medication might reduce your body's immune system in terms of fighting against COVID-19 specifically. So with that said, please make sure that if you want to take something for pain or fever, and if you suspect yourself having COVID-19, please use Tylenol, and the generic name is acetaminophen instead. And last but not least is I really, really want to stress that even though COVID-19 can be a very severe, can cause a very severe illness progression, just know majority of the cases, the symptom can be quite mild or even no symptoms. And if that is the case, even if you suspect you have COVID-19, there's absolutely no need for you to go in to see the doctors or other healthcare providers, and especially the hospital, because medical facilities, especially the hospital, are actually the hot spot for you to actually get in contact with COVID-19. And also because if your symptoms are mild, if you have COVID-19, we're going to send you home. So just be aware of that. Again, the last bit is just remember this video is just for general overall guidelines. It is by no means should be used as a replacement of the advice of your own personal healthcare provider or urgent care provider. So if you're in doubt, please do reach out to your primary care provider or urgent care for further instruction, okay? But otherwise, stay safe, stay healthy, drink a lot of water, sleep, and exercise, okay? All right, bye.